Hello, welcome to another episode of Arthritis and You, a Joint Journey. Today, we've got something special lined up, so buckle up because it's time for the deep dive. Let's give a warm welcome to our hosts, Arthur and Sarah.
Welcome to the deep dive. Today, we're really getting into the details of a medication many folks dealing with inflammatory arthritis might know, sulfasalazine.
That's right.
And, it's interesting because we did mention it briefly way back in, I think it was episode 3.
Mm-hmm. We touched on it.
But today is the full story, the deep dive as we call it. Our goal, like always, is to take all this complex info and make it clear, practical stuff you can actually use.
Yeah, cutting through the noise.
Exactly. And for this one, we've drawn heavily from the Alberta Rheumatology website, great resource, and their YouTube channel, too.
Very informative stuff there.
Plus, we have a really important question that came in from a listener, which we'll definitely get to. So we're going to unpack what sulfasalazine is, how it works, what you might expect if you take it, and, crucially, how it plays with other common meds.
Sounds like a plan.
All right, let's start at the beginning. What exactly is sulfasalazine? What kind of drug are we talking about here?
Okay, so fundamentally, sulfasalazine is what's called a DMARD. That stands for disease-modifying anti-rheumatic drug.
DMARD.
And the key thing about DMARDs, unlike, say, a painkiller, is they don't work instantly. They're slower acting.
Right.
But they're designed to actually modify the underlying disease process in conditions like rheumatoid arthritis or other inflammatory joint problems. They're not just covering up symptoms.
Got it. So it's a DMARD, but where does sulfasalazine kind of fit within that bigger picture of DMARDs? Is it for specific situations?
Yeah, that's a good way to put it. Sulfasalazine is often thought of as, well, maybe useful in, let's say, earlier or perhaps less aggressive cases of inflammatory arthritis.
Okay.
We see it used quite a bit for rheumatoid arthritis and also psoriatic arthritis. And very often it's actually used with other DMARDs, kind of a combination approach.
Ah, interesting. Combining them enhances the effect.
It often can, yes. And the main goal is what it does for the patient is reduce that joint pain, the swelling, the stiffness, real quality of life improvements.
Makes sense. And practically speaking, if someone's prescribed this, what does taking it actually involve? What are the pills like, the dosage?
So it typically comes in 500 milligram tablets.
Okay.
And the usual daily dose, it generally ranges from 1 gram up to maybe 3 grams per day.
And that's taken all at once?
No, typically split. So part in the morning, part in the evening.
Gotcha.
And it's really important to know that doctors often start you on a lower dose and then gradually increase it, kind of based on how well you tolerate it. The final dose can really vary depending on, the specific condition and the individual person.
Okay, so we have the what and the how much. So the big question is, how does it actually work inside the body? What's the mechanism?
Well, this is where it gets pretty interesting, actually. The honest answer is, we don't know the exact mechanism.
Really? After all this time?
It's true. Like a lot of DMARDs, we know it works by modulating the immune system. It helps to kind of calm down that overactive immune response that's causing the inflammation. But the precise step-by-step process inside the cells, that's still not fully mapped out, even though it's been used effectively for decades.
So we know it works, just not exactly how. Now, you mentioned DMARDs are slow-acting. That sounds critical for managing expectations. What's the typical timeline for feeling effects?
Absolutely critical. Patience is definitely needed. You won't take it today and feel better tomorrow. Generally, people start noticing some positive effects, some improvement, around maybe 4 to 8 weeks after starting.
Or 8 weeks, okay.
But to get the maximum benefit, you're often looking at more like 3 to 6 months of consistent treatment.
3 to 6 months for the full effect.
Yeah.
Right.
And unfortunately, the flip side is that side effects, if they're going to happen, can sometimes show up before you feel the benefits.
Right, that's the tricky part. So let's talk about those side effects. What are the common things people might run into, or anything more serious to watch for?
Okay, so common side effects often involve the stomach. Things like nausea, maybe some abdominal pain, or even diarrhea. That's probably the most frequent category.
Stomach upset? Makes sense.
Then you can also have an allergic reaction. That might look like a skin rash.
A rash, okay.
Less commonly, but things we definitely monitor for are potentially more serious issues like irritation of the liver or sometimes lower blood counts.
Liver and blood counts. Those sound like things you'd need tests for.
Exactly, which leads into how you manage the risks.
Perfect segue.
Yeah.
So, given these potential issues, what's the crucial advice for someone taking sulfasalazine to stay safe and minimize problems?
Number 1, absolutely vital. Tell your doctor if you have a known sulfa allergy.
Ah, because it's sulfasalazine.
Precisely. If you have a sulfa allergy, this drug is not for you. It's contraindicated.
Got it. No sulfus allergies. What else?
Always take it exactly as your doctor prescribed. Don't change the dose yourself. And importantly, speak up. Tell your doctor right away if you experience any problems, any rash, any unusual symptoms.
Open communication.
Yes. And back to your point about tests, regular blood work is essential. Absolutely non-negotiable.
How regular is regular?
It varies, but typically when you start, it might be every 2 weeks or so. Then, if things are stable, it might stretch out to monthly or even every 3 months, but we need to monitor those blood counts and liver function tests consistently.
Okay, that regular monitoring sounds key. What about the day-to-day stuff? Like, what happens if you accidentally miss a dose? Does it throw everything off?
Good practical question. If you miss, say, your morning dose or your evening dose, the best advice is simple. Just skip that missed dose.
Don't try to make it up.
No, definitely don't take a double dose next time. Just get back on your regular schedule with the next planned dose. As long as it's not happening all the time, missing one dose isn't likely to cause any major problems.
Okay, that's reassuring. And what if someone needs to stop taking it? Maybe it's not working, or they have side effects. Can they just stop, or does it need to be tapered down slowly?
With sulfasalazine, it's generally safe to just stop it. You don't typically need to do a slow taper or gradual reduction. However, it's worth remembering that if the medication was helping you, those benefits don't disappear instantly when you start.
Right, because it takes time to build up.
Exactly. So the positive effects will usually take probably at least 6 weeks or so to wear off after you stop taking it.
6 weeks. Good to know. Now, this leads perfectly into that listener question we mentioned. It's about drug interactions, which is a huge topic, especially since many people with arthritis are on multiple meds.
Very common scenario.
So the question was specific. Is it safe to take methotrexate with sulfasalazine?
Ah, yes, a classic question and a really important one because there's a lot of maybe misinformation or confusion out there about methotrexate interactions.
So.
Well, if you look up methotrexate on, those drug interaction checker websites or lists, the list of potential interactions looks terrifyingly long.
Yeah, I've seen those.
Right. But the reality, based on decades of clinical experience, is that many of those listed interactions are purely theoretical or very, very low risk in practice. So, to answer the listener directly, yes, it is very common and considered quite safe to use methotrexate and sulfasalazine together. Many, many patients do.
That's a relief to hear.
Yeah.
What about other common combinations people worry about with methotrexate, like anti-inflammatories?
Another great point. Some older resources might warn against using methotrexate with NSAIDs, non-steroidal anti-inflammatory drugs.
Like ibuprofen or naproxen.
Exactly. Or with certain stomach protector medicines, the ones called PPIs, or proton pump inhibitors.
Like omeprazole.
Yes. But again, in real-world rheumatology practice, these combinations are used all the time, and generally safely. It's honestly not unusual for us to have a patient taking methotrexate and sulfasalazine and an NSAID like ibuprofen and a PPI like omeprazole all concurrently.
Wow, okay. That really paints a different picture than just reading a list of warnings.
It does. Experience counts for a lot here.
So, if those common combinations are generally okay, what interactions with methotrexate should people actually be concerned about? Are there any real red flags?
There are a couple we definitely watch for. The main ones, where we typically recommend holding the methotrexate temporarily, is if you need to take certain antibiotics.
Which ones?
Specifically, sulfa-based antibiotics.
Like the trimethoprim sulfamethoxazole, sometimes used for UTIs?
Exactly that one. And also penicillin-based antibiotics.
Okay. Sulfa and penicillin antibiotics.
Right. Taking those together with methotrexate can sometimes increase the risk of side effects because they can interfere with how the body clears the methotrexate. So those are the primary interactions we are actively monitoring and managing in clinical practice. The rest generally are much less of a concern than the lists might suggest.
That is incredibly helpful context. It really helps to sort the theoretical worries from the practical reality. So, wow, we've covered a lot of ground on sulfasalazine.
We certainly have.
From understanding it's a DMARD, how it sort of works, the timeline, those potential side effects, and how crucial monitoring is, and busting some myths about drug interactions, especially with methotrexate. It really underscores that even a medication that seems like it's been around forever still has important details to understand.
Absolutely. And I think the bigger picture here, the main takeaway perhaps, is just how valuable it is to really understand your medications. Not just the name, but, how they work, what to realistically expect, what to watch for, and why your doctor has chosen that specific drug or combination for you.
It empowers you as a patient.
It really does, and it highlights why that open communication with your doctor and pharmacist is so vital. Talking about everything you're taking, any concerns, any side effects, it's a partnership.
Couldn't agree more. So, for you, our listener, maybe a final thought to chew on. Thinking about how these medications like sulfasalazine and methotrexate are carefully chosen, combined, and monitored. How might really understanding those nuances change how you approach managing your own chronic health condition?
Yeah, how does that deeper knowledge shift your perspective on long-term care?
It's more than just taking pills. It's about understanding the strategy. And of course, while we hope this dive was informative, please remember, this is general information.
Always.
For any questions about your specific health situation, your medications, your treatment plan, the best person to talk to is always your own physician or healthcare provider.
This has been another episode of Arthritis and You, A Joint Journey, brought to you by the Rheum team from albertarheumatology.com, your trusted evidence-based suite of resources available 24/7. Straight from Alberta, but for folks around the world. Our hosts today, Arthritis and Sarah Upas, technical producer, John Ifan, and our executive producer, Stephen Cates. While we work hard to maintain the accuracy of our information, we accept no legal responsibility for any errors or omissions. Remember, always check with your own physician first. Join us next time for another Deep Dive.